of the Latin America Committee, and we're very honored to have you all here tonight. If you don't know who we are, we're part of the Study Association of Bases of International Studies at Leiden University, and we organize events for students interested in Latin America or even studying the region itself. And we want to stress how grateful we are that we could organize this event tonight, as we've seen how busy lecturers and professors are during these times, as well as us students. So it means a lot that we can collectively use this space tonight to look at the impact COVID has on Latin America. For some practicalities, we've muted you all and we've made your cameras invisible for the most of you. It will be great to see some of your faces in the discussion later if the connection allows us. Also, some unfortunate news. Unfortunately, Maria Gabriela won't be able to join us here tonight, which means we'll have two lectures. We'll start with the one by Dr. Sergio Litewka, and then we'll have a lecture by Dr. Julienne Weegels. And finally, we'll have the discussion led by one of our own great lecturers, actually, Dr. Randal Sheppard. So without much further ado, Sergio, I'd like to give the floor to you. Thank you so much again for being here all the way from Miami.
Thank you very much, Meryl, for this kind invitation. Actually, I have to acknowledge that it will be even much fun if I were able to just enjoy the Netherlands, but still we hope that we are going to do that in another opportunity. But I'm very happy for this invitation. Well, as Meryl said, my name is Sergio Litewka, if you said that in Polish. I am a native from Argentina, and I work at University of Miami since 2000. It's almost 20 years now. I am a physician by training. I was a surgeon back in my other life in Argentina. And I am the director of within the Institute for Health Policy, for Ethics and Health Policies. I am the director of all the international activities. So I'm happy just to have this opportunity again. When I wrote the paper, I wrote a small piece that was published in Developing World's Bioethics. And that was written back in March this year, when the pandemic was just starting. And what we envisioned was that probably Latin America was going to suffer disproportionately in terms of the inequalities, and also because of the difference in healthcare system added to all the current illness, non-communicable diseases, and also infectious diseases that plague the continent. But we didn't envision how bad it was going to be. Can we see the first one, please? So first, we have a problem with how the Latin American healthcare system is allocated. And here I want to make some sort of a disclaimer. When we talk of Latin America, it doesn't mean that all Latin America is a single, all the countries are having the same problems. Actually, Latin American countries are totally different. They have shared commonalities in terms of language, with the exception of Brazil and Guyana. But other than that, there's different systems, there are different governance within their systems, and the healthcare systems are totally different too. So don't take the idea of Latin America as a single conglomerate, in the same way that we can talk about the European Union as just something homogeneous. In fact, Latin American, its countries are very diverse. So what you see here, it's how fragmented the healthcare systems are in different countries. Basically, what you have in the region mostly are public health systems, which are for those who has no kind of insurance of any way. Normally, they are overburdened by the demand of the people. It depends of the country. It depends of the province within the country. You have what normally it's being called as a social security system, which are insurance-based systems, probably in most of the cases related to the working activity of of the employee and being financed by the employee and the employer. And the private sector, which is for the most affluent class in the region, mostly in general, we could say 8–10% of the population has another insurance. It doesn't mean that those who have private insurance in some countries have better access to the system. In other cases, the quality could be irregular. It depends of which country, which region you are talking. The next, please. So one of the problems that COVID created in the region was that the healthcare system, and that was at the beginning, we were saying, okay, the healthcare system has very limited capacity, and it depends again of the country. But if you see, for example, my native country, Argentina, as of today, the beds in the public sector and the private sector all together are being used by 60% of their capacity. So it means that there is about 40% of capacity that it's available. And yet, Argentina is one of the countries with the biggest amount of deaths in the region. So it's not necessarily about the capacity of the healthcare system, but also the quality of the care that you are receiving. And also other characteristics are the financial volatility of the region. It depends on one country. And again, just to keep the idea that I mentioned about not seeing Latin America as a single country or as a single region, you have some financial volatility, for example, in Argentina, sometimes in Brazil, but not the same volatility, for example, or at the same level in Uruguay or in Colombia. So situations are very different in that regard. But one problem that it's general, it's the informal labor market. If I mentioned before that a big sector of the population is being covered by the work-related insurance. Now, of course, the informal labor market, which is overwhelmingly extended in the region, just to give you an idea, Peru, for example, has about 70% of its population which is working informally. They are street vendors, they are working, selling food, or they are doing different activities from one day to the other. What it means is that they don't have any safety network. And even if there is some plan during the quarantines of the mitigation process, just to keep those population inside their houses, just some sort of lockdown, that was totally impossible in many places. And even if the government, for example, in Peru, they tried just to give some sort of financial support to that big amount of informal workers, the consequence was that because they don't have any bank accounts, they were gathering in long queues at banks in the region, just trying to get their payment. On top of that, you have another humanitarian emergency, which is the almost 5 million, and I repeat the phrase, 5 million Venezuelans that are leaving the country because the harsh condition that they have to endure there, lack of food, lack of resources, political repression, and lack of future in general. So you have all this big population allocated in Colombia, in Peru, in Chile. Indeed, they are part of the informal labor market. They are immigrants, not necessarily are legal in the terms of having authorization for work. Therefore, they have no insurance at all. And in many cases, those Venezuelans, for example, in Colombia, they were expelled from the country where they were looking for refugee because they were overburdening the local system. So when they came back to Venezuela, the healthcare system is totally shattered, it's totally in ruins. The consequence was that didn't receive any care at all. And we don't have any information about Venezuela. We don't have any data because none of the data of Venezuela is trustworthy at all. The next, please. But there is another topic, which is governance. And governance, and again, once more, it's not the same concept in Uruguay, it's not the same concept in Chile, it's not the same concept in Costa Rica. Things are uneven. But mostly, there is a perception about the corruption in general in Latin America. There is no way, there are many surveys just to work. This is a survey created by the OECD, the Organization of Economic Development, Countries in Development, Cooperation Development, made by the World Bank in 2020, and from Transparency International also, in which it shows that briberies and public clinics and health centers, it's another problem. Not necessarily that happens elsewhere, but corruption is a big problem, or at least people perceive the healthcare system in general as corrupt. In one country is more than the other. I mean, it's not the same. The image here is very little, but for example, it's not the same in Costa Rica or in Salvador, or even in Argentina. In that case, it doesn't mean that the country are not corrupt. It means that the people that have not the same perception that, for example, what they have in Venezuela, in Peru, and Mexico, according to that survey. The next, please. And coincidentally with that, the 2019 Index of Perception of Corruption made by the Transparency International shows the same. As you see the score, the countries more in red are those which are perceived. Again, those are perception. It's not that you have a corruptometer, something that you can measure in some effective way how is corruption in those countries. Those surveys are being made in terms of asking people, and not necessarily related to the healthcare system, but in general, how they deal with the police, with the judiciary system, with the institutions in general, what you call governance in general. And then you see that in Latin America, Argentina, Brazil, Venezuela, all the countries are in different shades of red, which means that the perception of corruption is very high. I wonder how the United States will look after all the problems that we have here during the past 4 years, but this is a different story. Next one. Now, how the authorities responded in Latin America. And this shows how baseless were their assessment and how neglected was in many cases, not in all, how they responded to the emergency created by the SARS-CoV-2. And for example, you have on the left of the screen, President López Obrador from Mexico, who, like his pal from the other ideological extreme, Donald Trump, he was saying that you don't have to worry about, there's no reason to be worried about COVID. And in that photograph, he was showing two religious stamps with some virgin or saints or something like that, saying, I am protected from this and I don't have any reason to be worried about. And again, Mexico is a federal country, so mostly the way that different states responded was related to how the governments reacted to that. But in top on that, you have the narco traffic problems in Mexico. You have the lack of governance in many places. The north of Mexico, it's more or less a failed state because of the drug dealing activities. So you can imagine that that was a perfect recipe for disaster. In the right, the Argentinian Minister of Health, Ginés González García, at the beginning of the pandemic, he said, there's no danger that we will stop in Argentina, they will arrive the coronavirus. And I mean, he's supposed to be a physician. He's supposed to be an epidemiologist. And I say he's supposed to be because, and I remember I was in Bolivia when he was saying that. I was listening to that in my radio or in my iPad, just listening to tune in an Argentinian radio. And the explanation he gave, that was at the end of February, beginning of March, say, well, China is too far from Argentina. And besides, in Argentina, we are still in summer, so there is no reason to be worried about the coronavirus. Interestingly, according to the media, the former ambassador in China, in January, alerted the government about what was going on in China. But Ginés González Garcia was oblivious, or totally indifferent to that. The next, please. Well, Maduro, another Trump's Paul, he said, well, it's like a little flu. You don't have to be worried. And he was also advocating against the use of face mask. Maduro in Venezuela also was just inventing that he was taking measures when the Venezuelan health system is totally destroyed. And again, you have many few people working in the formal system having any kind of support. And Nicaragua, President Daniel Ortega said that unlike in capitalist countries, that it's under control in Nicaragua. Again, we don't have any reliable data about how things went there, but probably the virus don't care about whether you are a capitalist or a socialist country. Next one, please. So, on top of that, we have human rights abuses disguised as mitigation measures. Venezuela, Salvador, and Paraguay, there were thousands of people forced to quarantine in state-owned places in totally unsanitary conditions. That was compulsory. They were interned there without any possibility just to reject that. And that wasn't made necessarily not at all for epidemiological reasons, neither for political reasons, just for ignorance. The way that they found was just to put people who were suspicious for transmitting the illness just in those places. They disregard even WHO guidelines about the limits of mandatory quarantine, and they took people detained for beyond 14 days, but they were not testing anyway. So you were there, and maybe you didn't have any COVID, but then you end up being acquired COVID after staying there. And in many cases, those confined measures were used as punishment for political opponents. Again, that didn't happen in all countries, but we will show some examples. Next, please. I was one of the persons who signed that letter, and we create a neologism, which is infectadura in Spanish, which is a mix of infection and dictatorship. Because using in Argentina the pandemic, it was an excuse to limit the functions of the Congress, to limit the functions of justice, and to create different measures in the provinces of Argentina. Argentina is also a federal country, in where people had difficulty just going back to their homes or being detained for walking in the streets, something that it was totally irrelevant in terms of epidemiological measures. They had no kind of rational, in terms of, nothing was scientifically based, but was based in the advice of a group of people advising the Argentinian government that instead of being epidemiologists, they were mostly infectious disease specialists or people related to the government in some way. The next, please. And there are many cases. For example, when protections become repression, that it's denounced made by Amnesty International. Recently, cases like in Santiago del Estero, one province of Argentina, a father couldn't say goodbye to her dying daughter because she was dying of cancer, and the police didn't allow him, without testing, without any reason, just to see with her. In Santiago del Estero, a girl with a terminal cancer, that wasn't allowed to go back to her home after coming back to the hospital in a different province for the same reason. The next one, please. And then you have the politics. You have that the Argentinian government, Alicia Castro, the woman in the photo with the president of Argentina, Alberto Fernandez, she was a former ambassador in the Soviet Union, in Russia, excuse me, and in Venezuela. And she asked the government to not trust in the Oxford vaccine and to try the vaccine, the Russian, the Chinese, and the Cuban vaccine. That sounds absurd, but this is not science fiction. This is not, it comes from some absurdity comedy. It was real, and in response to that, the Argentinian government today, not today, but today confirmed that they acquired millions of doses of the Russian vaccine. And the problem with the Russian vaccine, as we know, is that there is only one paper published, as far as I know, in the Lancet. It's a vaccine using the adenovirus as vectors. But there is no international oversight about what's going on there. And as far as I know, there is no presentation to WHO or to the European or American organizations in order just to see or to have an independent overview of the vaccine. Next one. And Russia is offering financial support for using the vaccine. This is interesting in terms of vaccine nationalism, and something that it goes more for a sociological study or maybe some sort of psychiatric evaluation. But indeed, it's politics with COVID, which is not particularly beneficial to the population. Next, please. China also is offering the vaccine in exchange of money, not for receiving money, but to give it money in the Road and Belt program that they have. And they are testing the vaccine also in Brazil, in Latin America, and in Mexico and in Venezuela. The same happens with the Russian vaccine. We don't know much about how informed consent is being managed. We don't know much about how transparent the information is, unlike at least what we can access for Moderna, for Pfizer, for AstraZeneca, and Oxford, or for any other development. The Russian laboratory, it's part of the armed force of Russia. China is the same. So I'm not saying we have no elements to say that those vaccines are not going to be effective. What we are saying is we don't have the same information, and that's very dangerous. Next, please. And also, it's very dangerous because we have a crisis in the trust of the population about vaccines, any kind of vaccines. Remember, measles, and there is a campaign about people that are against vaccination, anti-vaxxers, for whichever reason. So this is increasing that kind of skepticism, the politicization of the vaccines. The next one, please. And again, countries cope as they could, but in Bolivia, in Ecuador, in Mexico, in Brazil, suddenly people dying were overflowing mortuary houses, and they were dying in the streets, or they were trying just to be buried wherever they could. And again, we don't know, and we will never know, how many of those lives could possibly be saved if the governments of Mexico, Brazil, some sort of Ecuador, and Venezuela, for example, could have a better approach or a more rational approach. It's not, for what we saw in the war, that's not a right and wrong position, but at least some rationally based decisions. Next, please. And as few days, you see that the top is the United States, which indeed is another problem. As you all know, it's a shame the way that the United States managed this pandemic under Trump. And there is no way to justify what has been done here, which again had to do with ideological wars between using a mask being a Democrat or not using a mask being a Republican. This is another problem that probably in the future will be analyzed as one of the most stupid activities that the United States population could have in terms of the response to the vaccine. But if you see on the left, Argentina, it's on the top 10 countries with more deaths in relation per inhabitant. And keep in mind that Argentina, after what we mentioned about Ginés González Garcia, and he dismissing the possibility of the pandemic being a problem for Argentina, after that, they imposed the longest lockdown in the world. So from March to almost November, people were almost impeded just to, if not going outside of their houses, they have to have a permit just to go from one place or the other, which create a huge economic crisis. Lots of business being shut down, lots of people going in bankruptcy. And yet, they didn't prevent the amount of deaths. The next, please. But also, it is funny how ideological constructions act. At the beginning of, not at the beginning, if you see the date, I don't know if it's too little, August 16, Time, a US publication, put Argentina among the best global responses to COVID-19 pandemic. And they said, which is very interesting, I don't know who wrote that, that the coordination of the three levels of government has been strong on public health as well as economic and social protection measures despite political difference. That's a lie. And the letter that we signed showed that that was a lie. We don't know how many people died in hands of the police. And again, this is not something that I'm making up. There are a lot of investigations about that because they broke those lockdowns. And for no reason, they were harassed, put in jail. And in many cases, there are many names of that, people died for that. Not for for COVID, but for the collateral consequences of COVID and the way that it was mentioned. Another, which is interesting, another article, Argentina is showing the world what a humane COVID-19 response looked like. Amazing. Next one. So, and today, Bloomberg, I had that in a previous presentation, Bloomberg released a graphic about what they call resilience to COVID-19. And they put a list of, I think, 53 countries in which you could be worse or better off if you contract COVID. And Argentina, it's among the worst off at the bottom of the list. But this one, next please, shows you that in terms of deaths adjusted by population, you have that the top three, that is from November 16. So we are talking, it's about a week ago. So you have Brazil, Mexico, and Argentina on the three top countries in the region that created more people died in terms of adjusted population, adjusted deaths adjusted by population. This is really, if you remember what we saw before about that kind of expression, that kind of assessment about the example that the Argentinian government did, made me think about which was the reason just for trying to put such an right lie. Next, please. So, wrapping up, what we have in Latin America in times of pandemic, what we know for sure that Latin America has been suffered probably. It's from we don't know much about other continents in terms of Africa, but Latin America had a humanitarian crisis of huge proportions in terms of pandemic, not only created by the pandemic, by COVID, but also created by all the responses. And again, it's not homogeneous, but some countries suffer really, really bad. Countries that fare better are those with better governance indicators. And for example, Uruguay has almost negligible cases of COVID and negligible cases of death. You could say, okay, Uruguay is a small country with no more than 3.5 million inhabitants. That's fine. But on top, regardless that, putting that aside, the Uruguayan government never put that kind of strict measures, never affected human rights, and never overall, they tested all what they could, and they tried to focus in the outbreaks and not the whole population. But indeed, dysfunctional and ideological-based political leadership contributed to the exacerbation of the pandemic. I cannot omit to mention that huge inequalities, inequalities, and a limited state response created a disproportionate number of deaths. But most of the population that suffered for different branches of the government are related to the most socioeconomic disadvantaged population. And this is a problem that will create probably for the future more, according to the Lancet, more than 231 million people that are predicted to live in poverty in the next year. Thank you very much.
Thank you so much, Sergio. That was really interesting. I'm looking forward to maybe discuss it a bit more in the discussion. That would be very great. I suggest we move on to the lecture by Dr. Julienne Weegels now. Julienne, are you there?
Yes, I'm here. I don't know if you can hear me or see.
Yes, I cannot see you yet, but I can hear you just fine. Yes, it's working. If you could briefly introduce yourself before you start, that'd be perfect.
Yes, thank you. So, hi everyone, I'm Julienne Weegels. I'm a researcher and assistant professor at the Center for Latin American Research and Documentation, which is part of the University of Amsterdam. And I've been working a lot regarding COVID. I've been mostly working regarding COVID in Latin American prisons. And I've been part of an initiative organized by the Latin American Society of Criminology, researching COVID in prisons. But of course, at the same time, keeping track of the news and, let's say, the research of my fellow researchers at the CEDLA. Also keeping track of protest, which is a different arena in which I normally conduct research. I'm specialized, as I mentioned, in prisons and in Nicaragua as a regional focus. I will be talking a bit more broadly, of course, about the region as a whole, about protests and lockdown, and the influence of COVID-19 on politics and order and disorder in Latin America. Next slide, please. So the setup of the lecture is that, so it overlaps, and I realize this now that Sergio was talking, so a lot of the things that he was talking about, you will see kind of come back during my presentation, and I will touch on them less because he has already touched on them a lot. So I'll discuss a little bit the pre-pandemic context of regarding protests. Then we'll move into the situation that Latin America found itself under when the world went into lockdown. I will then move into the oddity, let's say, though there were also protests in European prisons, but the oddity of a lot of protests appearing in Latin American prisons at the beginning of the lockdown, at the beginning of the COVID pandemic. I'll then move into protests that have taken place since the start of the lockdown, so that have kind of taken place in spite of lockdowns. And then I will give some ideas or move into kind of, what's going on now. We're not yet in the post-pandemic time, but we're seeing protests pop up ever more strongly, with Peru, of course, as the most recent example. So I will move into that as well. And as I go, I will also be touching on these kind of structural underlying issues to take into account when we look at politics and protest in the region. So you can go to the next slide, please. Yes, so 2019 was the year preceding this horrible year of 2020, or this very strange year of 2020, to say the least. 2019 was a year full of protests for Latin America. And most of these protests were directed directly against sitting governments. Of course, we have in 2019 that it started, let's not say it, but that the first protest of 2019 was in Venezuela, when in January Guaidó proclaimed himself president, and this move was accompanied by quite massive protests in Caracas, at least, which were quite violently repressed. That's, let's say, Venezuela, of course, and all of these countries, but especially some of them have had years and years of protests already going on. So I do want you to keep in mind, as I move through this list, that it's not exhaustive, and that it's not that they were just protesting in January or just protesting in November, but that there have been buildups to these protests, but that these are kind of mass protests that started in 2019. So this is followed by Haiti. In February, massive protests against the sitting government, accusing of corruption, widespread corruption, especially of earthquake funds and of Venezuelan aid, the disappearance of Venezuelan aid. Then we see in October, well, in September, we have Honduras protests against sitting President Juan Orlando Hernandez. In October, we have protests in Ecuador, which are, let's say, the first in a series of protests, which I would say Ecuador, Bolivia, Colombia, in a way are all related to the implementation of what is called the paquetazo, the neoliberal new package of measures that governments were supposed to be taking in order to kind of steer clear of economic downfall. This has a lot to do also with the plummeting oil prices and things like that. But that said, so in October we see protests in Ecuador. In Chile we start seeing protests much for the same reasons starting in October. Of course, you know, they officially, let's say the protests in Chile officially end in November when Piñera, the president, says, okay, we are going to rewrite the constitution. But of course, those protests have also continued. So mobilization has been quite constant, though not as massive anymore as between October and November, and of course, until the Chilean lockdown. Bolivia, of course, the infamous, well, let's say by now infamous situation of the ousting of Evo Morales by way of popular protest, the installation of an interim government that suddenly appeared, let's say the cure appeared to be worse than the disease, and by now has been reverted, not placing Evo back in power, but with the electorate choosing for the current leader of the MAS, the party that Evo Morales was president of. And in Colombia, for the first time in a very long time, quite massive protests and a huelga nacional on the 21st of November. And this really marking a time in which, after the peace accords, which were signed in 2016, and the continued, let's say, wave of murders of social leaders, especially in the countryside, and people standing up and saying no to this continued onslaught, let's say, of state violence or state-sponsored violence when we think about Colombia's intimate relationship with paramilitary groups and the like. Now, my own context, the context that I come from, let's say, looking at this wave of protests is the context of the Nicaraguan protests that started in April 2018, and that quickly turned very massive, but also very violent in terms of the state response. leaving over 300 dead, over 800, if I'm correct, imprisoned, politically imprisoned, and over 100,000 people fleeing the country due to the violent state response. So one of the things that is kind of a common denominator in this wave of protests, and in which by 2019 the protests in Nicaragua had been stomped out by the government, is the common denominator of state forces using excessive force and committing human rights violations in order to stop what are generally, initially, quite pacific protests, or which, to say the least, aren't armed resistance groups. So it's not like there is an armed insurgency and the government should respond with armed weapons or shooting at protesters, but that is effectively what in many countries has happened, and many of these protests have left people dead, not as many as in Nicaragua in most cases, but with some quite newsworthy issues, such as the shooting of protesters in the eyes in Chile, which is something that has been denounced, let's say, on a global scale. So that was tumultuous 2019, and 2020 was projected to be, by the end of 2019, was projected to be a year full of change for Latin America because of these protests and the strength of these protest movements. But, of course, then comes the pandemic. So next slide, please. Yes, so before we move into the lockdown and understanding the lockdown and understanding subsequent protests, it's important to look at a couple of underlying issues. The dissatisfaction with democracy, I'm just going to pick that one out as a key element. There is a situation in all of Latin America where, according to the statistics of the Latino Barometro, the amount of people who are dissatisfied with democracy has risen from 51% in 2009 to 71% in 2018. And these are very high numbers. So these are very high rates of people being dissatisfied with democracy. Now, that doesn't mean that they have become pro-authoritarian, because the percentage of people who would support an authoritarian government has remained the same, around 15%. It is simply the fact that they are disillusioned with the type of democracy that they are experiencing, with the results that perhaps initially progressive governments promised and are not able to come through on, especially regarding the reduction of poverty, but also the promise of inclusion into politics. So the promise of participatory democracy, which was often at the top of the agenda of what are called so-called pink tide governments, which include, of course, all of the ALBA governments, which, by 2009, we had a panorama that looked very much left-leaning for all of Latin America, except for Mexico and a couple of differences there, here and there, but mostly left-leaning. Most of those governments were not able to come through on the promises that they made. And rather than, so this has led to two things. On the one hand, a swing to the right. On the other hand, a swing away from politics, in the sense that people decide not to go voting. So abstinence or assistance rates from attending elections are higher. And the idea that the democratic system is not the way to come to power or to make politicians do what they should be doing. So that's also why the street and protesting has again become so important because the electoral route is less and less trusted to be able to resolve issues that people are struggling with. Now, there are three underlying issues here that are very important, that are economic inequality, the fact that Latin America is one of the few regions in the world that saw their life standards between, let's say, 2010 and 2020 not improving. Even though they had democratic governance, they did not see their living standards improving. That alone was reason for the World Bank and the IMF to come up with economic measures to, make the Latin American markets, become more competitive and, produce the famous trickle-down effect. But those paquetazos, as the set of reforms was called, and this is a term from Ecuador, weren't people did not agree with those particular reforms taking place based on their prior experience with neoliberal reforms taking place in the years before, in terms of the late 1990s and the early 2000s, and their general wariness of reforms on economic markets producing any kind of wealth distribution or trickle-down effect. Aside from that, or alongside that, is what we see a very much dissatisfaction with corruption. The whole Odebrecht scandal, of course, plays a big role in that, in the dissatisfaction with governing presidents. But also more, let's say, for the ALBA countries, this idea, like, where did the money go? So all of this Venezuelan aid, all of this money that Venezuela was pumping into Haiti, was pumping into Nicaragua, where did it go? How is it possible that a social security institution is no longer able to pay pensions if you've been receiving over the past 5 years more than $2 billion in Venezuelan aid? How is that possible? So that's also where people, with the corruption and the disappearance of these monies, and seeing that particular people are always the ones who remain on top, of course, produces a lot of incentive or grievances, reasons for people to protest. Next slide, please. Now, against that came the lockdown. So the lockdown in Latin America, as Sergio was already mentioning, was actually started very early. So in some countries, lockdowns were implemented, or restrictive traveling measures were already implemented before the first corona cases were made known in the countries. And many times they were implemented before the number of known corona cases hit 100 in the country. So very early action against the pandemic, which, as Sergio has already mentioned, nonetheless wasn't able to resolve, wasn't able to prevent people from from getting sick. But there was also a very varied response. So we had some countries that implemented very heavy measures. As Sergio already mentioned, Argentina did the longest lockdown. Peru had initially a very tough lockdown. Chile also, Honduras, but also some countries basically ignoring the pandemic, either by claiming that there was no communitarian contagion, as the president of Nicaragua for a very long time was able to sustain, until basically people were dying in the hospitals, and that was coming out in the news, and he had no other choice but to admit that people were actually dying of COVID. And in Brazil, where Bolsonaro famously called COVID a gripezinho, and refused to take strong measures against the pandemic, believing, of course, that it would gut the economy. Now, of course, these economic concerns have a foundation because, as we see, I mean, we're entering a phase of, let's say, global economic downturn, but especially in Latin America, where the region was already in a phase of economic stagnation or very minor economic growth that has rapidly reversed. Worries, of course, about the capacity of public health systems to be able to deal with large numbers of people falling ill. Health systems that, as Sergio explained, are of course very varying across the region, very divergent capabilities, but that as a common denominator have the lack of capacity of dealing with large numbers of sick people at the same time. Health systems that are often already overburdened, especially when we think about public health systems. And in that comes the issue of how does private healthcare fit in there, and in how far is private healthcare going to take up part of the responsibility? And that was, of course, a big unknown when the pandemic started. And what we see is that during the lockdown, the inequalities that already existed became larger, and they were exacerbated. We see this also in terms of how people responded to the lockdown. Some people, if they don't go out to work, they don't have anything to eat at the end of the day. So that was a big concern in countries like Peru, as Sergio mentioned, where 70% of the population is dependent on the informal economy, where you don't have any insurance against losing your job. There is no other choice but to go out to work. Whereas in other countries, they attempted to make some form of compensation payments. Actually, in Peru, there was also the attempt to make compensation payments. But that falls very much short of people's actual economic activities, and has led to many businesses needing to close, and to, well, the widening of the gap between the rich and the poor. Next slide, please. So what we see, which is very interesting, because I work with prisons, that was quite unexpected, but that could be expected if you would think about it a little longer, is that prisoners began protesting to be included. So in a way, Latin American prisons are often considered, let's say, the cloaca of society, where people are dumped into, and then the gate is closed, and that's it. And you can just fend for yourself inside prison and figure out how you survive. Your family supports you, so that there's very complex, and this is of course very different across the region. But the general sentiment among prisoners is that they are disposed of into the prison system, and that aside from the guards, nobody else cares for them. It doesn't matter if they live or die. They live largely in overcrowded conditions. And with the COVID pandemic, living in overcrowded conditions in prisons that don't have adequate health provision, in which medicine is already difficult to come by, in which if you are sick, you already have to fight for getting an appointment with perhaps the prison medic, perhaps being transferred to a public hospital to be attended. That's already so complicated inside prisons that prisoners were directly afraid of contamination by COVID, because they felt that once one person is contaminated inside prison, then basically the virus would spread very quickly. So they began protesting with these kinds of pancartas, these kinds of flags and protest boards, saying that they have the right to life, that they want COVID testing to take place, Family members also protested for adequate health care for prisoners. And many of them also, tried to question the fact, well, isn't this a time to think about early release, the liberation of prisoners who've committed minor offenses, like, for instance, being caught with 2 joints of marijuana, these, very petty crimes, thinking about how to, also thinking, more, let's say, the criminological side of things, was thinking directly like, okay, how might this be a moment to reform the prison system, and to think about policies that replace freedom-taking measures for other kinds of measures, like like social service, or other types of punishments. So some of these protests turned violent. Some of them turned into escapes from prison. They were mostly at the very beginning of the pandemic, and quite quickly subsided. One of the largest effects of the pandemic on life in prison has been the fact that prisons have effectively been closed off from the outside world, in the sense that in most countries, visits are no longer allowed, family visits. And that's been going on for quite a couple of months. And given the fact that most of these prisoners' livelihoods depend on their family members being able to bring them food and medicine, it has had varied responses across the region in terms of, no longer knowing what's going on inside prison because family members are no longer able to see their loved ones. And, so the prison also turning into a black box in that sense, and being quite difficult for researchers to continue to access. But at the same time, luckily, the amount of prisoners who have died due to this very restrictive measures has been quite low. So next slide, please. So one could say that their protests helped. The next slide, please. Yes, thank you. So what we see as the lockdown kind of continues is that on the one hand, of course, the first protest that we see is the protest by medics for better equipment. The fact that this was, of course, a global phenomenon, that there wasn't enough testing material, there wasn't enough facial protection, there wasn't enough protective equipment, there wasn't enough breathing machines, all these kinds of issues that medics turned up to protest for. But that was quickly surpassed by protests by, let's say, the impossibility of stopping economic life, though in some countries it was grinded to a halt, and the protest against COVID measures, so against government measures against COVID, because people were feeling like, well, literally, I can't survive if I can't go out and do my job. There's no money in my bank to keep me going for a while as COVID lasts. Nobody's going to pay back the investments that I've made in a particular small business, for instance, in my grocery store or in my shoe shining business. So any kind of work that you can think of, especially for informal work, was directly in danger by the extensive measures taken to make society go into lockdown. And there was, to a large extent, an inadequate mitigation of these effects of the government measures. And then go to the next slide. So what we see now is we enter, as we're still full-fledged in the pandemic, but entering, let's say, a phase in which the pandemic is becoming increasingly part of our lives. What we see is that people, and especially people who decide to protest, are going back to the underlying issues. They're also linking issues that have to do with pandemic politics, so with the measures taken by particular governments, they're linking them to underlying issues. So, and this is not just, conspiracy theorists or anything like that, but this is the notion among some sectors in society that the measures are taken especially to hurt them as a particular group, so to hurt informal workers, for instance, or to advance corporate interests and make small businesses close. So all of these things combined, of course, relate very much to these underlying issues regarding social inequality and regarding a distrust in the government. Now, something that also was mentioned by Sergio, the fact that the government or state forces who were enforcing lockdowns often used violence against people who were breaking lockdown rules doesn't help in contexts where, of course, protests against human rights violations and protests against the abuse of state power has been a long-term underlying issue. So in some cases, we can see that this, is starting to be pushed beyond the tipping point. And in some cases, we also see that people really feel that there are more important issues than the pandemic, and that the pandemic just kind of clarifies and exacerbates these issues rather than the pandemic itself or COVID itself being the problem. So they really see the political response to COVID as part of a problem that has been existing for a longer time. And their main, let's say, focus, the elements that they focus on most are, of course, social equality, but also accountability, transparency. We can see this issue of accountability very strongly in the protests around the sudden ousting of President Vizcarra. There were a lot of protests during the lockdown against his way of dealing with the COVID pandemic, but suddenly when he was, ousted from the presidency by the parliament, people were like, "But wait, that's not a democratic process. That's not how it should be, and we didn't elect this Merino guy." So, and because Vizcarra was prior to the pandemic very much focused on tackling corruption in Peru, people suddenly thought like, hey, wait a second, now they're ousting a president who was against corruption, and that must be related, to interests within the parliament to get Vizcarra out of the way. So we see again that the protests are moving back toward these fundamental underlying issues, and that they are also moving back toward these other underlying issues of, aside from governance issues like accountability and transparency. They're also moving back to issues regarding social justice and environmental justice. And those issues, I would say, or I would expect to see that, especially social justice when it comes to police violence, when it comes to the excessive use of force by state forces, is something that will continue to be at the top of protesters' agenda for as long as states or governments decide to use their state forces to violently repress these protests. So that's where I would leave it. Thank you. And I very much look forward to engaging in conversation with you.
Yes, thank you so much, Julienne. I really enjoyed how you and Sergio's presentation complemented each other so well. So yeah, I suggest we just move right into the discussion. Something good to mention that for anyone watching, if you want to ask a question, you can press the hand raising icon on the right, and then we can give you your turn, and then we can also see you, which would be nice. Randal, are you here? Yes. Perfect. if you could introduce yourself, that would be perfect.
Okay, I'm Randal Sheppard. I'm a lecturer here at Leiden University in Latin American Studies, so I hope you can all hear me. First, I just wanted to thank Julienne and Sergio for really fascinating and highly relevant papers. We're all here talking at the moment about the impact of COVID-19 on Latin America, so it's really interesting to hear both of your perspectives. And hopefully we can all meet somewhere, whether it's in the Netherlands, or my preference would probably be to meet in Miami at some point. But hopefully when we start talking about post-COVID Latin America, we can do that soon. And so my role here is really basically to facilitate the discussion. So I think we all have questions, but at first we've got so many. Oh, and the other thing, I should also thank our BASIS Latin American committee, who've done a fantastic job, Meryl and everyone, in putting together this incredibly interesting and successful webinar today. But as Meryl mentioned, if you have any questions, please just raise your hand and then I can introduce you and we can see you and we can get the conversation going. So if anyone has questions, please put up your hand. If not, I can start off. And one thing I was thinking, I work a lot on Mexico in particular. One of the arguments I've seen in Mexico is you have this sort of, as in a lot of places in Latin America, things are very polarized at the moment. And you have on the one side the argument that the figures show that the government has mismanaged the crisis, and López Obrador's comments are also part of this very poor government messaging. And then on the other side, there's the argument that basically, as both of you have touched on, that you have countries such as Mexico that have fairly weak state capacity, that you have large sections of the population that live day to day and that can't afford to stay at home and not earn, and a government that can't afford to pay for them all to stay at home. You have concerns about rising authoritarianism, so the government's reluctant to enforce lockdowns. And therefore, really all that can be hoped for is to manage the crisis and the pandemic. And what that means in the case of, say, Mexico, is to avoid the health system becoming overwhelmed. And so therefore, the government has done what it can do, which is not great, but overall, that's all you can expect. So I'd just be interested to know whether either of you have an argument about whether that's a reasonable position or a counter argument to that.
So, you want to start, Julienne?
Okay.
Okay, I will take it.
Yeah.
I want to say first that I am really happy that it worked so well with Julienne, because it looks like we agreed beforehand what we are going to say, which wasn't the case, but it was like if we are like that. So it was a great presentation, Julienne. Thank you very much. Probably I disagree with you about the concept of neoliberalism and all that stuff, but that will be for the next meeting when I will be in Amsterdam and a beer there. Going to Randall's question. Again, Mexico has many countries inside. Now, you have to look. Mexico has a huge, the Instituto Mexicano de Seguridad Social, IMMS, which is, as you know, what covers most of the population there, but also have a big informality. Now, obviously, López Obrador is a popular person. He was chosen by 60% of the people. Excuse me, for 60% was about. And yet, his approach to the pandemic, in my opinion, was totally baseless, with no scientific base at all. But also, it depends the region. You have to consider Mexico. Go to the north of Mexico. It's almost a failed state. I mean, the authorities in the north of Mexico, it's based on the narcos. And they rule most of the state in Sonora, in all the area near the border of the United States. So you have a problem there in how it's being managed. So it's not an homogeneous thing. Now, López Obrador, for what I remember, was advising in April or late May that everybody should embrace themselves and just be happy and no use mask or nothing like that. That was stupid. And that was in parallel with his pal, Donald Trump. I remember here in the United States, many people thought, well, Donald Trump is going to clash with López Obrador because supposedly Trump is from the right and López Obrador represents the left. Both are populist, and populism has no difference in terms of what they are doing. So I think that we will never know, as I mentioned before, how many people, how many lives could have been saved if, in a very difficult context, we could have the chance to have more rational leaders. And we didn't have any leadership. And also, because of that, Mexican population, as you know, if you have been in Mexico, you have the taxi drivers, you have those who are serving food in the streets, those who are, they are living day by day on what they can make. So it's very difficult to handle the situation. And going to your point, maybe it's very difficult to a president saying, okay, we have to have a big lockdown and just trying to keep the people preserved from COVID, because there's no way you can do that. Yet, what I see, at least in one way or the other, is a total lack of leadership, what you expect from a president of a country. And so I cannot be benign with López Obrador. I have my bias against him, I have to admit. I think that it's something that's taking Mexico backwards in science, in academia, and in economy as well, in terms of his love for oil and thinking in a structure that make Mexico probably close to rich in the 20th century, but not looking towards the 21st century. So I take your point, but I cannot be totally benign with it. I have my bias. I'm sorry.
Yeah, no. Interesting, Julienne.
Yeah, maybe I can just add to that I think, I mean, we need much more research on the impact of measures taken against COVID against, let's say, the actual incidence of COVID. And one of the major issues that we struggle with in Latin America, but not only in Latin America, is the lack of adequate testing, or the availability of testing, the lack of how do you say, trustworthy sources of information about testing. And because worldwide, and that goes for Latin America as well, it's questionable how much impact government measures have on the incidence of COVID. And that's like what we're seeing continuously and more, is that, well, actually the impact, or let's say the number of COVID cases in the Netherlands, where we never had an actual lockdown, but a partial lockdown, is perhaps lower than a country where they have had a total lockdown, like in Spain or in Italy. But it's very difficult currently to map those things against one another. And that's also where you get these claims from left and right, or populist and more democratic governments alike, who say, well, the way that I handled it is better, in terms of and that's where it's complicated. So I kind of would refrain from saying, oh, this measure is better, that measure is better. It really depends on what people are doing in the place as well. I'm thinking of Nicaragua in particular because the government decided not to do anything, or to do very little, and to kind of downplay the incidence of COVID in the country, and to go house to house and do their kind of medical awareness campaign, much as they would do with dengue or other diseases. And that received quite a lot of criticism. But at the same time, because people were so much hearing criticism from all sides, you could see that people were using masks all the time, anywhere, at least a large portion of the population, until at a certain point the government had to say, okay, we're actually also having an incidence of COVID, and we advise people to wear masks. But still no adequate kind of testing rolled out or anything like that. So it becomes difficult to what the government's doing, what people are doing that might help or that might go against government rules. So it's still quite murky, but like as a baseline, I think that until now, it's very unclear whether strong government measures actually are able to lower the cases.
Yeah, very interesting. I find that very similar. And I mean, comparing, we're all Latin Americans and living in other countries. And I think looking at our own countries and comparing the different methods and where they work and where they don't is, I agree. I think it'll be a while before we actually know if there are any successful measures and how they've been successful.
Yeah.
Yes, we have a question here from Talia.
Yes. Oh. Hi. Yes. Hello, where to? Yeah, my first question is, in your opinion, if COVID will allow or present a chance to Latin America countries to develop in a different ways, maybe in a more green, focusing on like green economy or environmental sustainability. I know that this has been an argument also for Europe, but I'm particularly interested in Latin America because it has been very much focused on dependency theory in the past. So I was wondering if if it can be considered a way to step back from the West and say, okay, this is our way to do things now, maybe trying to create different narrative. Yeah, I just wanted to hear your opinion about it.
Well, the narrative is one of the particularities of Latin American governance and some people. If you see how they were portraying through time the success of Argentina, narratives is very successful in the way that they can convince things that it doesn't happen. I'm pessimistic. No, again, I'm not thinking in Latin America as a solid one single place. I think in that, for example, maybe countries like Uruguay has a long-standing story of democratic support. There was some military intervention in the 70s, but other than that, Uruguay, with government from the left or the center-right, it's mostly stable and with a very low level of perceived corruption. So Uruguay, and with more equality among the population, Uruguay has still a very extended middle class, which is particularly relevant. The same could apply to Costa Rica, for example, and so maybe those are places that you could see some improvement or lessons learned if they still keep their abilities to sustain the liberal system. And when I'm talking about the liberal system, I'm talking about the Republican system, not Republican in the United States, I mean the Republicanism, and not particularly authoritarian things. Now, countries like Argentina, Brazil, Colombia, Venezuela has deep divisions inside. And I think that COVID will exacerbate, because of the poverty that will generate, that gap between those who are in one side of the gap and who are in the other side. But the way that there is a kleptocracy in all those governments, like the Argentinians, the Venezuelans, in which the way to live is just to take public money in their own benefit. And there you have another considerations in the equation, which nobody knows how it's going to be in the future, in my opinion, again, which is the extension of narcos, the narco industry in Latin America. And there was a time that was Colombia and all the problems that they have, but now you have Peru, you have infiltration in Argentina. On top of that, and there is and I finish with that, there is I would say that there is the trend, which is a global trend, which is what it has been defined as illiberalism. And you have in Europe, in Hungary, in Poland, which are the despised for whichever reason. It's probably for another topic about the democratic system as such. And in the United States, indeed, with Donald Trump, the experience with Donald Trump also, it's some sort of rejection of liberalism. I'm talking about liberalism, I'm talking about what came after World War II and was the liberal order that made some sort of, that favored some sort of development in general in the world. So I think that those countries that I mentioned are totally immersed in that kind of struggles. And because of that, I think that COVID will exacerbate all those big differences. Hopefully I'm wrong, but that's my pessimistic view.
Yeah, some colleagues of mine work on degrowth, and so the notion of degrowth, I'm sure you're familiar with it, and circular economies. And in the beginning of the crisis, they were quite excited, let's say, like, oh, this might be a chance to for things to really change. I must say that I was feeling the same toward punitive politics. I thought, oh, wow, this is going to be the moment to rethink prisons in the region. But unfortunately, all of these big changes that we would hope that a pandemic, that a crisis like this would help us think toward, progressive changes, seem to be going quite in the opposite direction. So I'm quite worried about these, let's say, I'm quite worried, especially because economically the measures, the lockdown measures, have produced such a harsh effect on people's livelihoods and economies. I'm quite afraid that big businesses are going to take advantage of that situation and rather kind of more roll out large-scale maquilas or taking advantage of so many people being out of a job. And governments, eager to please their electorate, will much more easily say, like, oh, that's a direct solution. I'm going to open up an industry. People are going to work there, rather than throwing it off the other end and saying, well, we're going to create a new circular economy, and having their electorate go like, what are you? What do you want? What do you mean? So yeah, I'm a little bit pessimistic as well.
And also, Julienne, one thing that it's important, I was thinking, there will be, because of the unemployment that will grow, because of assuming that there is a vaccine next year and people can start their normal life, but there will be lots of consequences, and lots of people will be unemployed because the way of living, it doesn't exist much. Restaurants, hotels. Thinking about people who are part of the middle class in many places. I'm not thinking of those who are already in the informal sector. So there will be less money for supporting social security systems because there will be less people working there. Yeah. So what one can think is that there will be more people disenfranchised with the concept of democracy as we understand. I don't know for where it will go, but probably they will resent the fact that they have been excluded by a big sector of the society, and it can go everywhere. I don't know.
Yep.
Yeah.
Not a very bright picture, but I wish I could say something better. But.
Thank you so much for your input. Thank you.
Thanks a lot for the question. And we actually have a question in the chat. So before we go to Diana, I'll just read this question from Oscar. And he asks, since in Latin America, there is a high number of people not formally registered as healthcare beneficiaries, not even in the public health systems, how an effective vaccination program may be put into place to reach them and have an accurate control on the evolution of vaccination process. So maybe, Sergio, you want to start with that.
Thank you for that present. No, it's a wonderful question, actually. Because of all this informality, you need a big infrastructure just to work on that. And I don't have an answer. I mean, something has to be done. Again, we have different countries. It's not the same Uruguay and maybe some parts of Brazil. And even within Brazil, if you take Sao Paulo, Rio de Janeiro, the south of Brazil, Porto Alegre, probably you have sectors which are more all the formal information is already collected there. You go to the Northeast, Recife, Pernambuco, Ceará, Amazonia, and probably things are totally different. The same applies with Mexico. I think that again, we will have, again, I don't have an answer, but for example, I was listening to the news today, and in Argentina, the plan is to make vaccines mandatory. Then they discarded the idea of making mandatory. But the idea is, as of today, it will change tomorrow. You cannot choose what vaccine you're going to get. So there is a problem here. It's a logistical problem first, because most of the vaccines are 2 doses. So you have to have some sort of register in the register who received the first and from which vaccine, so you can give the second shot 20 days or a month later. That's an issue. The other issue is, if that's the case, that the government still is keeping that idea, what if I don't want the Russian vaccine and I want AstraZeneca, but I don't have the resources to buy AstraZeneca or Pfizer or Moderna or whatever, and I receive the Sputnik? So it creates another division. The same happens in Venezuela. Again, I am not prejudging against the effectivity or the efficiency of the vaccines. What I'm saying is just that difference will go. It seems that if the governments are not smart enough just to create a reasonable and transparent plan, what you can get is people reluctant to be vaccinated, which is already widespread in the whole world. That will happen. And any adverse event will multiply the concern about being sick now or in the future for some particular vaccine. And that could be backfire against the idea of having a normal life in the foreseeable future.
Did you want to add anything to that, Julienne? Nope. Okay, well then we'll move on to Diana.
Oh, hi. Hello to everyone, and especially thank you. Well, thank you to everyone, and hello to Randal, who I had his lecture a few years ago. So I'm so happy to see
you again.
Yeah, I have a question that's kind of a follow-up question from the previous one. So even if governments are unwilling to implement progressive politics that one would hope for to enhance social security systems and invest in green infrastructure and so on, do you foresee a moment of reckoning that happened, in Chile or even in the US with the Black Lives Matter movement, emerging out of a place like Brazil, which has a more deeply entrenched authoritarian regime? Is this something that we see on the cards and in the table?
I mean, yes, definitely. Hopefully, there will be moments of reckoning coming up. I know that during the Black Lives Matter protests in the US, there were also some, though not many, protests in Latin America, including in Brazil, in the major cities, especially Rio and Sao Paulo, because police brutality in Brazil is such a big issue as well, and it's also very much along colored lines. So that's something that there is in common. What I see as kind of more difficult, so the types of issues that people rally around and that big mass protests appear from are generally not, let's say, environmental issues. They tend to be issues that are much more related to social justice, to dissatisfaction with institutions, with corruption, with the idea that a president is no longer doing his job correctly, and therefore should be removed. The idea of, the popular vote, you voted for someone. So if you mobilize against that person, then at some point they will have to leave power. So in a way, also this dynamic of protests, while there are, of course, a variety of social movements who are very much specifically geared towards specific political projects or specific end goals like environmental justice, these mass protests are often much more directed at direct change of the executive. And one of the things that they often, in a way, kind of go or strive through or kind of ignore in that sense is it's the over-reliance on that a change in the executive branch will produce a change in the whole system. So this idea that, well, if the president goes away, then all the political problems of the country will be solved. Or if we have new elections, then there will be a resolution of the issue. So that, in regards to both your question and the questions that came previously, that's also why, in terms of protest, it's quite, sort of mobilizing protests is quite difficult to rally around these issues that are socially perceived to be smaller. But there are very strong, in some countries, very strong movements who do it, who simply do it, who are in their communities and who set up these circular economy networks, who implement these things at a barrio or a community level, and are quite successful at doing so. Thinking of the Movimento Sem Terra in Brazil, but so that's one of the bigger famous ones. But yeah, so there's that discrepancy between, let's say, mass protests against a government, against a president, and social mobilization or protest for particular more narrow issues.
Yes, briefly, I think that I agree with Julienne in general. I think that that moment of reckoning will come in big crisis, but mobilizations in Latin America, there are mobilizations everywhere, but mobilizations in Latin America are very divided. And what I see, and again, I'm sorry to focus most in Argentina, the country that I know more because I'm from there. There is a big mobilization from middle classes, for example, against corruption and against the manipulation of justice. Those days, streets of all the country has been packed with people mobilizing against a move that wants to almost invalidate the judiciary system in order just to support in a trend to a more authoritarian government. Yet, I don't know whether those movements will succeed because there is a big gap between the interests of most of the people in Latin America are concerned about a single thing, which is corruption, because it affects their life. Now the problem is when they go to vote, the options revolve around similar things that looks apparently different, but are part of the same problem. And that's part of the endogamy Latin American political. And again, I want to put aside Uruguay and Costa Rica. I insist because those countries that, as of today, as far as I know, they have a more health. The Republican system is much more healthier. But and the analogy with Black Lives Matter, yes, as Julienne said, in Brazil, where there are big racial gaps, it's probably a possibility. But again, you have to consider that, and Bolsonaro, and I don't sympathize with Bolsonaro at all, I made that disclaimer before, but Bolsonaro is a consequence of the corruption of the previous regime. Bolsonaro came after a response from the people, not from Lula, not from the first term of Lula, in which probably everybody acknowledged all the things that socially Lula did in terms of improving the standard of life of people, Bolsa Familia, all things that, but the corruption that came afterwards with the PT, with the Workers' Party. So people are reacting some sort to corruption. It doesn't mean that Bolsonaro is less corrupted, probably not. It's more elegant or not in the way that they are doing, but people get tired of politics, and that's the dangerous thing when they start to love authoritarian figures, because at the end, as they said in Argentina for many years, que se vayan todos. We want all out. And we want all out, we know what it means. It means that somebody will fill that vacuum with authoritarian ideas. It could be Trump saying, I'm not part of the elite of the politicians. I came to Washington to drain the swamp. He didn't drain anything other than his own swamp, and not even that. But that's the figure that the people are buying. When they vote, they are trying to vote for something like that. And this is the dangerous thing I see.
Thank you very much, both of you, for that answer. I think that highlighted a lot of concerns and organizing in the future. And I want to make just a brief point on what you said, Sergio, that in fact what you said was the motto of the revolution in Lebanon. They said, kilon y aniquilon, o sea, todos de todos. Yeah. Everyone is everyone, and everyone must go. And then in the end, they had a regime changed, and then which was completely connected to the previous regime, and now they have the same prime minister who was ousted.
They changed something that everything goes back to the normal, to what was before, which was not particularly better. There's no choices. That's unfortunate.
It's this exact paradox that's on the lure for in Nicaragua, where you have these massive protests and this idea everything has to change, everything has to go, the whole system has to go, everything's connected and everything has to go, and then in the end this idea todo tiene que cambiar para que nada cambie. Everything has to change so that nothing actually changes, because at the end what we see is that the old wolves take over the politics of the mass social mobilization, and in a way the efficiency of the repression of the regime, which totally stamped out the protests at a very high cost to their own legitimacy and to, of course, to the protesters, was effectively able, in combination with demobilizing by scaring the living beep out of people, demobilizing them, and then ensuring for politics to continue. And that political field is precisely what people are so tired of, and that's what has taken over now. So this idea, oh, we're going to go into elections in 2021, and people who participated in the protests are like, who on earth is going to go to elections in 2021? That's Ortega's going to win, period, because, well, but this is, the paradox of sometimes wanting extreme change and then things going sour.
That's another global pandemic, isn't it?
Well, thank you guys so much. I'll let other people ask their question.
All right, thanks a lot for that. And we'll move on to Fernanda from the Embassy of Chile.
Yeah, now, hi, hello, good evening to everyone. I would like to thank the organizers for this webinar, which is very interesting, especially for me coming from Chile, which my country was named several times during the conversation. And I would like to put something on the table, mostly, to share a thought from an academic point of view, not from the official point of view. I will take that liberty, if you allow me. So I'm not talking from an official point of view of the embassy. But I would like to put on the table the idea of all that we see, that you have said, Julienne and Sergio, especially regarding that each time people mobilize to throw the leadership, and they go to vote and they choose again another corruption, another person that has another story of corruption, or the new government that will do more or less the same. So my question is, don't you agree with me maybe that for me at the bottom line is a matter of education that we have lost in Latin America, to educate our people with values like ethic, like civic education, to live in community, to respect each other, and to have values about not to rob or not to, this mercantilized society sometimes. I'm not talking about liberalism alone, but where things have a price and there are no values behind. And also, for example, to avoid drugs, to all the, I don't want to get into details, you understand me what I mean, but for me at least the bottom line is education. We have lost, because if we have more educated people, with values. They will not vote for corrupted leaders. They will not rob. They will not get into drugs, maybe. I understand, and of course, I'm not denying the social problems. Of course, if you can get a high salary, a low salary, and you can get easy money from drugs, well, and you have, I don't know, kids dying or whatever, I'm not judging. But I would say that at least if you have more education, you will think it twice or 3 times, or you will try to find another way, or you will reject it at all. I leave it on the table.
Fernanda, I totally agree with you. And going to your country and not putting you in the uncomfortable situation of just because you are representing the embassy of Chile. But personally, this is my personal opinion. When I was seeing all the uprising last year, I think it was 2019, and how the public transportation has been destroyed, shattered in Santiago's street, or I was seeing the TV. And I was wondering if that was the kind of change for a government that was democratically elected by the population. I mean, Piñera was elected in free elections. There was no fraud. There was a total, people elect one way of government and suddenly you see all that kind of destruction, and you see, okay, this is part of the pandemic before the pandemic. It's some sort of narrative in which apparently, that's my opinion again, that some policies can be reverted by destroying public property that in fact affects all of you. And this is a problem of education indeed. Now, my question in general is, where does education have to start? Elementary school, high school? Because we are seeing that kind of problem elsewhere. And again, I'm not denying the right of people to have that kind of violence if they are fighting against an authoritarian imposed government, as it happens in many parts. But in the case of Chile, it's amazing. And also because Chile, putting aside Pinochet and all the sad moments of the dictatorship in Chile, in general, before Pinochet and after Pinochet, has also long-standing tradition of democratic rule. So I wish it were only education. Indeed, education is one part, but it's only probably a single part. There's some sort of misconstructions in terms of what it's been under. And again, that's the same concept we were talking before, that que se vayan todos. It's that idea that goes nowhere, except just to create a vacuum in the political system. But yes, I agree.
I'm always uncomfortable with the issue of education because it tends to divide people into civil and uncivil, and we all know how those divisions go. So that's where my problem with education, or when we reduce the debate to an issue of education and to an issue of values or morals, that's where I get queasy, because I've worked a lot with people who end up on the other side of the stick of the law. Not only protesters, but of course prisoners since 2009. And I think the question of education is very important, but it's also very big. And it's bigger than the issue of values. It has to do also with, let's say, adjacent issues pertaining to the independence of educational institutions, pertaining to the equality of education. So the fact that public education in many countries is so much more substandard than private education, and the social, let's say, the social divisions and the social issues emanating already through these kinds of divisions in education. So I'm very much for like the transformative potential of education. I worked in Nicaraguan prisons as part of re-educational programs, so I can't say that I'm against education. But education tends to become very easily politicized if we center it around values. And that's also one of the things where I have critiqued the Nicaraguan system for, and where, because it is prone to very strong politicization, and we can see this also in Brazil in terms of this new movement of Escola Sin Partido, and it can change very rapidly into critical education versus moral normative education, and exacerbate really these differences. And if what we want is for people to receive an education in which they can be free to choose, in which they can be free to be themselves, whether it is that they are left-wing or right-wing or gay or heteronormative or whatever. And those types of freedoms, that the educational systems that exist at the moment in Latin America, there are very few educational systems that have a public educational system that is open and relatively unpoliticized. And I'm saying this from a position where I believe that everything is political. So to say that education can be unpolitical is not really, my own point of view, but let's say that it's sufficiently separated from state or party systems. So that's where, let's say, where I would interject a little bit of worry or critique on the educational front.
I'm afraid I'm going to disagree a little bit with Julienne, and maybe I'm afraid. It's not necessarily about education in terms of academia. Let me try to explain my position. And I think, yes, it's about values. And let me explain you why, at least for my position. I'm a physician, as I mentioned, and I work for many years. I have been working for many years in research ethics. So research ethics is about how you conduct with humans that are going to be participating in some clinical trials or study or whatever. And it came to my working many times where some values are supposed to be relative. And I'm not a relativistic. I mean, what is wrong is wrong. And I'm sorry, I'm not a Kantian, but not totally, because I don't know much about Kant, except things that I read. So I want to impress you saying that I mentioned that I mentioned about the categorical imperatives. But what I think is that slavery, it's bad, regardless of whether your culture or not allows slavery. It's bad because morally, intrinsically, it's bad. Discriminating against women or anybody because of the sex condition, it's bad. I don't care where it's bad if culturally in some particular country women are supposed to be culturally accepted as inferior. It's bad. And the same applies with values in general. There are some minimal values that I think that it's not discriminating. It's trying to have the same set of values that we are supposed to share as human beings. And in that regards, I think that it goes, it's because of the education, but not because of some sort of elitist education, if you wish. But it's about teaching that kind of values that are universal, in my opinion. And I think that in Latin America, but not only in Latin America, we have some sort of one-side vision sometimes in which human rights are for one sector, but not for the other. So what we accept as human rights violations, according to who is in the power and we sympathize with, are human rights violations. And in the other hand, if they disagree with our position, we can make a blind eye on that. So that kind of hypocrisy, I think, it's part of what, if we are educators, at least, I don't know, I'm just getting old, so I don't know for how long I will be bothering people. But in normal conditions, our obligation as educator is just to try to work on that kind of set of values without being afraid of being considered that we are not relatively, we are just particularly focused in one position. We are trying to defend universal human values. Destroying a city, it's bad because it's bad, not because you fight against one or the other. I mean, there are mitigating circumstances if you are fighting against a dictatorship. But if you're fighting against a democratic elected government, it's bad, regardless. You can protest, you can go to the street, you cannot destroy the metro system in the way that many people that are poor and need public transportation are going to use. And the same applies with the stores, groceries, things like that.
Okay, thanks for that. We might have to move on to the next question. So thanks a lot, Fernanda. And we'll move on to Liliana, please. Is Liliana still there?
I'm here.
Hi.
Hello, good evening, everybody. As a fellow Argentinian, I'm paying attention to everything that's being said here, and I find the whole conversation really, really interesting. And I have a particular interest in populism in Latin America, and I wanted to, to combine a bit the thoughts that were, expressed in the last two questions. And my question is, do you think that politicization of COVID, of the crisis, and the management or the lack of good management of the current governments in Latin America, especially thinking of Argentina and Brazil, that are very, on opposite sides of the spectrum, right, having their ideology. Do you think the crisis will have an impact on the perception of populism in the region? How we view left-wing populism or right-wing populism. I mean, especially with the emergence of Bolsonaro as a right-wing, let's say, icon of populism in Latin America, and Fernandez, who didn't start as a big populist, but throughout the months of the crisis, you could see the Fernandez we had at the beginning of the crisis and the Fernandez we have now. The rhetoric has changed radically, and we start, if you analyze it, if you look a little bit at the elements of the rhetoric, there are a lot of elements of an emerging, strong populist, side of him. So if I think we had levels, right, or labels for our traditional populism, with Perón or Vargas in Brazil, you had the neoliberalism, Menem, Fujimori, Collor de Mello. You have radicals like Chavez, and will we have like a COVID label for populist leaders? And also, will that affect the expectations of voters? Speaking of the electoral volatility Sergio, you were speaking about before. So those two questions in one, like how will this affect, the view of populism in the area, and will that affect also the electoral volatility and the electoral, expectations of leaders after a crisis of this magnitude?
I assume, Liliana, you are from Argentina somehow, if you mentioned
I am.
Yeah, it's
Chaqueña in Dinamarca.
It's a problem.
An Argentinian in Denmark, yes.
Yeah, it's complicated to answer, because those who are like us from Argentina, we have been dealing with the same question with all the years of Peronism. And so before COVID, Peronism has a metamorphosis, changed into several phases. And suddenly it goes from the extreme right, sometimes it's from the extreme left, sometimes it's some sort of so-called liberalism, but it's not liberalism. So it's like a hydra with multiple heads. And Bolsonaro, I mean, if you look at Brazil, for example, have a populist like Getúlio Vargas back in the 50s. But unlike Argentina, it didn't create that kind of legacy that still is hampering in Argentina. So we don't know. There is a COVID populism for sure. And in Argentina, they were trying to create something, if you remember, without taking places about whether it was just or not. I think particularly it was an unjust war. But it reminded me of the 80s when Argentina went into war against the UK because of the Falklands. That kind of revived new nationalism. It's like we are all together fighting against the virus. Like if the virus were some opponent that we can see and hit. And populism, somehow, it's like a cult. It's not rational. People follow populism for hate, for love to the leader, and to hate to the others. It's that kind of division that the populism tries to exacerbate. So the only example I can mention to you, Liliana, it's what I find as form of nationalistic populism in terms of the vaccines. Mm-hmm. And in terms of suddenly people in Argentina saying, we want and again, it's not something that it's been making. I didn't make it up. I mean, it's on the records, it's on the media. They were preferring the Russian vaccine or the Chinese vaccine, not because of the quality. I mean, I'm not talking about the population. I'm talking about the leaders, which those are what we are really concerned about, because they said we don't want that vaccine from the imperialist countries. So what is your health? So what are you talking about? And again, that's part of the cult. And that kind of nationalism, I don't know how it will end up with this pandemic. Hopefully it will be over. I have no way to predict that. But surely if the economic situation gets worse, probably there will be also some exacerbation of that kind of populism. If Brazil fares that apparently economically they do a little bit better, maybe Bolsonaro will be some sort of a hero. And all these movements will be disregarded in the same way that those followers say, in the same way that you have here in the United States of the Trumpians saying that Biden is a communist. Come on, Biden is not a communist at all. It had nothing to do with communism. And it's similar to what we could say about how they portray themselves as heroes. Now, in Argentina, it's a very particular situation because the person who is in charge is not the president, but the vice president, who already imposed the president in the position that he is. So she is the one who is already driving the country who knows to where. So eventually, if Fernandez failed, Cristina Fernandez, no relation with the other Fernandez, will say, I was the one who was the good captain who took that. So we can have all kind of social populism. You have Maduro showing in TV, he's the first putting a shot of the Russian vaccine, saying I'm strong. So that kind of irrational things that normally will be part of a comedy now are part of the daily life of all these countries. Who knows? I don't know, Lian.
Yeah, we don't. Too early, I guess. Yeah.
I think we're running out of time, unfortunately. But Julienne, do you have anything to wrap up?
No, I think I'll stick with the previous pessimist note that it can still go anywhere, and I agree with Sergio that nationalism is definitely something to keep an eye on, whether that's national authoritarianism or national populism or other forms of nationalism. It's a typical thing that returns for Latin America in crisis. And what we might be seeing is a lot of swinging of the pendulum. So if one government was seen to have responded wrong, then his political opponent will be the next president, and that kind of going either way. So, and in that regard, I don't know how big the differences between right and left actually are if we look at populism or authoritarianism or nationalism as a marker. I think that in that sense, the Latin American left and right kind of converge in terms of their nationalist agendas. So, yeah, I agree in that regard.
I totally agree.
Yeah.
Thank you very much.
Definitely. Well, thanks a lot. Thanks a lot, well, to Sergio and Julienne. I guess Meryl is in her right, should wrap us up today, but it's been very nice to be with you and to hear this discussion. I mean, thanks to everyone who's participated today, just from my point of view. It's been fascinating to hear this discussion and really interesting to hear the responses.
Thanks for having this opportunity. It was a very enjoyable meeting. I'm not. It's not just being. It's not public relations. I really enjoyed this a lot. I'm very happy to have this opportunity to meet all of you.
Thank you so much. Yes. So to wrap it up, I would like to thank you first of all, Sergio and Julienne, honestly, for taking the time to do this, and yeah, your presentations, your in the discussion, we just really enjoyed it, and it was such a pleasure to have you here. So thank you so much. And also to Randal for leading this. That is just, yeah, really great as well. It was so nice to have all these questions as well. I figured we might end a little bit earlier, but we didn't. So I hope we didn't really change your plans that much, Sergio, because I know you have a national holiday there coming up tomorrow. So yeah. All right. Well, then I just want to thank anyone who came, and also the rest of my committee, Milena, for doing all the Cultura backstage, and Sarah, Aitana, Nicholas. Thank you all for making sure we could do this tonight. And we really hope that we could maybe see you in real life one day or in another webinar, because it was a pleasure.
You don't have to insist too much for having me in Amsterdam, I can assure you.
No. It's just a really nice opportunity to have, you live from Miami as well. That is, I think, maybe a positive of the pandemic, that it's a bit easier than showing up instead of taking a flight. But
absolutely, thank you very much.
Yeah, so then it's the end of our webinar, guys. Thank you so much, and we hope to see you again later.
See you soon.
Thank you very much. Thank you. Thanks a lot.
For the opportunity.
Thank you.